Hi, good afternoon to all viewers. My name is Dr. Ofelia Villanueva. I'm a general dentist in Quincy. I practiced dentistry in Quincy for at least 17 years. I graduated in the Philippines year 1976 and got my degree in Boston University Graduate of Dentistry as advanced student 1991. I am here today to represent the Academy of General Dentistry. Academy of General Dentistry is an organization in America, and it supports and advocates the general dentistry. My show will provide you and update your knowledge and education regarding all phases of dentistry. I will try my best to show you every month for 6 months all the different fields of dentistry, like periodontist, like gum treatment, oral surgery, it's like extraction of the teeth, endodontics, which is like saving the tooth, root canal, in order to save the tooth, to protect the tooth, and you can use it for a long life. Periodontics, which is for children, and other like general dentistry. Today, I would like to introduce you my friend, a well-known orthodontist in Quincy. He is Dr. Stephen R. Abramowitz. He practiced dentistry for at least
33 years.
33 years. Wow, it's a lot of time. 33 years in Quincy, serving Quincy community, right? He received his degree from Tufts University School of Dental Medicine in Boston. He is a member of American Association of Orthodontists and Northeast Society of Orthodontics. It's a pleasure to be here. And Dr. Abramowitz, I thank you for letting me to interview you on my first show.
Thank you. It is a pleasure to be here, and I hope that both Ofelia and I can bring to the general public some information about orthodontics, and I'll show you how we go about doing some of the procedures and try to explain to you why everybody will end up having some orthodontics either for themselves or a family member.
When should children be seen by an orthodontist? What age? What type of treatment will be done? And why an orthodontist?
Well, the American Association of Orthodontists believes that we should start to see first screening at about the age of 7 or 8. And it's important that the children see an orthodontist so that we can monitor their growth and see what type of early intervention programs we can do for the children. Early intervention could be anywhere from some serial extraction, removal of baby teeth to allow the other teeth, the permanent teeth, to come in, usually the lower front teeth, and the placement of space maintainers. And sometimes we'll give our patients a headgear, but it's really to predetermine at that age when the permanent teeth first start to erupt in the mouth to see an orthodontist.
Oh, that's good. What do you mean by when an orthodontist say, when they go to your office, you did an exam? Because me as a general dentist, I referred patient to Dr. Abramowitz also, and I tell my patient, you need an orthodontic treatment, and he will explain to you all detail because he's a specialist on that. What I mean when an orthodontic say an appliance will be used, like a bionator, a space maintainer, or a retainer?
The term appliance is really a funny term because when I first say, well, I want to do a certain type of treatment for your child, I'll say we'll use an appliance, and people right away think appliance, a washing machine, a refrigerator. Every orthodontist throughout the world uses that term. But an appliance is some type of device that we're going to give to our patient to wear for a certain period of the day or permanently. You mentioned a space maintainer, which is a nice thing to show you because we use this early on in treatment. If we have a 7 or 8-year-old child that comes into the office and you know why you're going to the orthodontist many times as a parent, because you see crowded front teeth. And if it's necessary to take out baby teeth, primary teeth, to allow the other teeth to come in straight and for the bone to develop normally, we would recommend tooth removal. And then it's necessary, at least in the lower arch, for the lower teeth, to put a space maintainer in. And it's a very easy device, and the children adapt to it very, very quickly. And these are worn until the child goes into braces, which usually for girls is 10 or 11, boys 11 or 12. But there's variation when somebody would start orthodontic treatment. It really is based upon the number of permanent teeth, when that patient has their permanent teeth in their mouth, and what the problem is.
My next question to you, I know you explained already about the space maintenance, How about what are retainers and why are they so important? Like a fixed retainer, like after ortho, like there's a lingual, and now they are plastic. So
I would say every parent that has had a child in orthodontics knows about retainers, because most of the time there's a compliance issue with wearing a retainer. But we stress that a retainer is very, very important to help hold the correction that we've achieved with our fixed appliances, with our braces. And there are different types. One type is the plastic appliance. Here's that term again, appliance.
Appliance,
But it's not a dishwasher. It's a plastic appliance. This is an upper one, and it goes on the upper teeth. The plastic is on the palate, and the plastic and this front wire hold the teeth. There's a horseshoe-shaped one that we use for the lower arch. Again, it has plastic on the inside of the mouth and a thin wire going across the front. That's called a Hawley retainer. It's one of the oldest types of appliances that
it's
our
a Hawley
patients...
appliance.
Hawley appliance. Another type of appliance that we use now is, with the new materials, we use invisible types of retainers. And this is an invisible type of retainer. And this goes over the teeth, and it's pretty much, people will not see the appliance when the patient is smiling. And this is becoming very, very popular now. Another type of appliance is we take a thin wire and we glue it to the inside surface of the teeth. And this is called a fixed retainer.
Yeah.
And we're using more and more of these appliances as our materials are becoming better and better.
Yeah.
So those are the three types of appliances.
How do you indicate, what do you use, in a patient?
There's no ideal retainer.
Oh, okay.
Having said that, if the patient is able to have good oral hygiene, we would start to favor a fixed retainer, because a fixed retainer, it's a little bit harder to clean behind the teeth. If the patient is prone to losing things, then we would like to use something that's a little bit brighter so that the patient can see it. If the patient is very responsible, then we would start to favor an invisible retainer. So it really has to do with patient cooperation and patient knowledge of what's expected.
Yeah, it seems me, myself, I like this better.
It's invisible.
Yeah, as well as, you cannot easily lose it.
But it's hard to sometimes see, and everybody has a story of a neighbor or a friend going through the trash at school or at the McDonald's, because retainers get thrown away.
Oh, too bad. Okay. Now, thank you. And about the Invisalign, I know as a general dentist, I know about Invisalign, and we can do it also. Only attending that seminar, which is very costly, then you can apply Invisalign to the patient. But I decided to have my orthodontist do the Invisalign. Would you mind to tell them what is Invisalign now?
Invisalign is a system that's been developed over the last 5 to 10 years where it's set up for adult treatment. And it works by having a series of trays, almost like an invisible retainer. This is an Invisalign tray. And the patient wears each succeeding tray for 2 weeks at a time. And each tray moves the teeth just a little bit. As the tooth moves a little bit, you go into the next tray. Depending upon the severity of the correction that is needed, depends upon how many trays.
How long do you have to do that? Because I know the traditional orthodontic treatment is 2 years. You know, but how about the Invisalign? Is it shorten the time or?
Usually it takes about the same amount of time for Invisalign or for what you're considering traditional braces. But even braces have sped up a lot. 20, 30 years ago, we used to treat our patients for 2 to 3 years. Now, a lot of our patients are finishing within 18 months to 24 months. And that's due to the types of materials that we're using. They're completely different than what we used 20 years ago. We use wires that are titanium, heat-treated, heat-sensitive wires that work over weeks, that work over months, rather than 20 years ago, we used to see our patients every 3 or 4 weeks. Now we see them every 6 to 10 weeks. And the treatment is much, much easier for the patient and for the orthodontist.
It's a good, interesting, you know, it's interesting. Tell me about the importance of good oral hygiene while you are having braces. You know, if you send a letter to the dentist who referred you, you're telling they need every 4 months cleaning. Can you explain that?
I like my patients to see their dentist every 4 months. Most of the time, because of insurance constraints, where the insurance company will only pay for a cleaning every 6 months.
Yeah, twice a year.
It's difficult to have the patient go in that extra time for that oral hygiene appointment. But oral hygiene is paramount to good, successful orthodontic treatment. Every once in a while, you will see somebody that has had orthodontics, whether recently or 20 years ago, with white spots on their teeth. And that's from poor oral hygiene. And it's a shame because the orthodontist and the patient and the parents all have put in time and effort and money. And to have those type of stains on the teeth, which are very, very difficult to remove, after that kind of treatment, it's because of the poor oral hygiene.
Do you think that poor oral hygiene also contributes, like, I see patients have an overgrowth tissues when they have braces, and you cannot see the teeth anymore. And when they come to me and they'll ask me, is it going to be gone or what do you want me to do? I said, you need more oral hygiene, you know, good oral hygiene. You have to brush, really brush. Is that the cause of that, the poor oral hygiene? Is it going back to normal after the braces is out?
Poor oral hygiene, whether you're wearing braces or not. If you're not wearing braces and your hygiene isn't what it should be, you will see that your gums bleed and they get swollen. With the braces, it only compounds it because the food collects even more because of the braces that are on the teeth. Often, once the braces come off, the gum tissue will shrink back. Sometimes it's necessary to have some gingival or periodontal work done.
How long before it go back? Is it necessary to have a gingivectomy or cutting of the gums in order to speed up, you know, going back into a normal gum?
After the braces are removed, if the gum tissue is very, very swollen, the patient has to have a good oral hygiene appointment at their dentist, and then it usually goes back within 2 to 4 weeks. If it doesn't really shrink down enough, then we would look at a periodontal solution.
Now, my last question to you is about adult treatment. You know, I see patients, they are already grown up in an adult stage and they have overlapping. And as a general dentist, you know, I see that and I told them if they're interested to change, their normal, their occlusion at this time, not occlusion, but the bite of the patient. And I mentioned to them there's an adult orthodontic or adult treatment at this time. And I asked them if they want it, or if they want me to refer to them, to Dr. Abramowitz or to any orthodontist. So can you tell us about that adult treatment?
Adult treatment now in most orthodontic practices is at least 15%.
Okay.
My practice most likely is about 20%. For some reason, I've always had a lot of adults come in for treatment. Adult treatment would involve sometimes wearing Invisalign trays, as I showed before. A lot of people like to wear that because it's invisible. And another way that we have our adults is wear ceramic braces. Ceramic braces are really invisible, and we use white titanium wires. It's quite...
It's good, That one has a
Actually,
different kind of colors, right?
This
They're
one
like
is...
a green or red, and this one is clear. I like the clear.
These are the clear braces. These are the more traditional braces that most of the children are wearing. And I have colors to show that with braces now, it's not like it was years ago. The kids put on different colors depending upon where they go to school, what sport team they are on, what holiday is coming, and we change the colors each time that they come in. It makes it a little bit more fun for the kids. But adult treatment, all of the adults will choose a ceramic brace or the Invisalign system because these are really not very noticeable. In fact, Tom Cruise, I think, completed his treatment with these braces about 2 years ago. I didn't even realize he was having treatment until I saw an interview with him. And I said, am I seeing something on his teeth? Because my eyes always go to a person's teeth. And I realized that he was having orthodontic treatment.
I like what you said. Your eyes is always on the teeth. I'm doing that now.
Most people have eye-to-eye contact. I think dentists go eye to teeth.
Oh, eye to teeth. All right. Now, Dr. Abramowitz, why don't you show us your office, please?
Wonderful.
Okay, thank you.
I'll take the X-ray room, and we take a Panorex and a Ceph, which measures out the growth potential of patients, sterilization area, and laboratory. Most orthodontic offices have open bay concepts, and it keeps it very, very informal because our patients are young and they feel more secure with other children around. And we also have a chair by each chair, treatment chair, where the parent can come in and sit.
I think you gave us enough information, so much information for the viewers to understand the meaning of orthodontics or orthodontist. Dr. Steven Abramowitz, thank you so much. I appreciate it so much on my first show that you are my first guest. And to you, I will try my best to invite another dentist, which may be a periodontist, a specialty on the gums, and give you some information or updated information of what they do to save your gums and, of course, to save your bone and teeth. Thank you and have a nice day. Goodbye.
Thank you very much. It was fun.
Yeah, thank you.